It's happening every day. Accidental injury is the #1 cause of death among Australian children, and many of these accidents occur in and around the home. But this problem can be controlled. All it takes is an awareness of household hazards and a basic knowledge of first aid. This video will help you to transform your home from a potentially dangerous place to a safer one. In an emergency, move swiftly, but remain calm. Calmness will help comfort the child. Assess the situation, checking for any dangers to the child or yourself. Note the position of the child and any injuries. Check for unconsciousness.
Open your eyes. Squeeze my hand.
Remember, if you suspect the child has broken any bones during an accident, do not move them unless they are in immediate danger from something in the accident area. If there is no response, assume that the child is unconscious. Immediately place him in the lateral position to ensure that the tongue and secretions do not block the breathing. Remember the ABC of saving lives. A is for airway. Check the airway and clear it if there is any obstruction. B is for breathing. Look, listen, and feel for breathing. And if it is absent, start mouth-to-mouth resuscitation. C is for circulation. This means checking for a pulse in the neck, and if it's absent, start external cardiac massage. Serious accidents require medical attention, so always have emergency telephone numbers on hand. Emergency numbers change from region to region. Make sure you have your correct local numbers. An ambulance may be called by any member of the public without a doctor's authority for any medical emergency. But how could we have avoided this emergency in the first place? Many people think that accidents are just a matter of fate. However, accidents can be prevented if we take a little time to identify hazards around our homes and take steps to control them. Let's identify the hazards that contributed to this accident.
A major problem is the design of this veranda. It has no railing. Any place in the home where a child can fall should be protected by a barrier. We must also keep in mind the behaviour of young children. They are compulsive and they love to climb, wriggle and squeeze through or under any obstacle in their way. That is why any railing built to protect children from falling or entering a dangerous area must be built with this in mind. Vertical rails must be used rather than horizontal bars that a child can get a foothold in and climb through. The gaps in the railing should not be wide enough for a child to squeeze through. They should be 55mm minimum to 85mm maximum. It also must not have an overly wide gap at the bottom where children could slip their bodies through and entrap their heads. Home, like the workplace, should have a system of rules on how toys, appliances and other products are to be used. It is important to teach children when they're ready to learn what the rules are. For instance, our Captain Zap should not have worn a mask over his eyes and should wear a helmet when riding his bike. If all these precautions fail, we must be prepared to handle the injury quickly and effectively. This means having the emergency numbers available and knowing first aid.
Let's look at controlling another major injury, cuts and lacerations. Make sure that all large glass areas in your home are made either of toughened safety glass or laminated glass. Danny, better if you play over there, mate. Ordinary glass, if it's hit hard, will break into dangerous pieces that can cause horrific injuries. Take steps to prevent these injuries. If you can't afford to have the area reglazed, consider purchasing safety film, a plastic coating that will hold the glass together if it breaks. And make sure that people realise the glass is here by using these colourful markers.
Children have a fascination for pocket knives. hazards that cause wounds can be identified, they can be removed and safeguarded.
If after all your care, a serious cut does occur, administer first aid by inspecting the wound to see if anything has become embedded in it. If there is nothing, press firmly on the wound with a clean pad or your fingers and elevate the injured limb to slow heavy blood loss. If, however, there is something embedded in the wound, do not attempt to remove it. To stop the bleeding, press firmly on either side of the embedded object while elevating the injured limb. Have someone call an ambulance. Once the bleeding has stopped while waiting for medical help, you can build up a ring bandage around the embedded object and then cover the wound firmly with a clean handkerchief to control further bleeding. Make sure that you don't tie the bandage so tight that you cut off circulation.
Anna, are you there?
70% of all burn injuries to children are caused by hot liquids, often leaving lifelong scars.
Cups of tea and bath water are the main hazards. Try to identify burn hazards in your home. They can be controlled by turning down the hot water system in your home to approximately 57 degrees centigrade. Call the gas or electricity company in your area for help by ensuring electrical leads are kept at the back of kitchen benches. In some areas, you can purchase curly cords to make this job easier, and by making sure that little ones are not underfoot when you are serving hot foods. Remember, hot water burns like fire. Not only do boys from 8 to 12 years like to experiment with matches and inflammables, but also they like to imitate the actions of adults. So the father here is acting irresponsibly. If anyone catches on fire, it is most important to get the flames out as quickly as possible. Do this by rolling the child on the grass. All children should be taught to stop, drop and roll if their clothing catches on fire. Remember, stop, drop to the ground and roll until the flames are out. If a scald or burn does occur, follow these steps. Remove all clothing quickly unless it is stuck to the skin. Clothes hold in heat and make a deeper burn, and do not prick blisters. Take off anything tight, such as jewellery, because burns cause swelling. Immediately submerge the burnt area in cool water or run plenty of cool water at a gentle flow over it for at least 10 minutes to reduce the heat in the skin. The child with a large burnt area can be placed in a bath of cool water, not cold, until an ambulance arrives, but no longer than 10 minutes. This is very important. Cooling the burn prevents the heat from cooking into the skin's deeper layers, but never use ice. Children have been dangerously chilled in baths of ice water. Cover the scald with a clean, non-fluffy cloth like a cotton pillowcase, tea towel or sheet. This reduces the danger of infection. Never use butter, oils, powder, creams or anything to cover the burn. These would have to be removed before treatment.
For anything other than a small burn, the child must be taken to hospital, so call an ambulance. After a frightening situation, a child can suffer from shock. The body often reacts to fear by slowing the flow of blood. Oxygen to the brain is reduced, and the child will appear pale and unwell. Shock can also occur when the body has lost a lot of fluids, from a bad cut, for example. Hospitals must be on the lookout for fluid loss and resulting shock in burn injuries, since body fluids are easily lost when the protective layer of skin is gone. If a child is suffering from shock and they are conscious, the best thing is to reassure them. Lay the child on his back and raise the legs. However, if you suspect a fractured leg, do not do this. Loosen any tight clothing, keep the child warm, but do not overheat. Do not give food or drink either, in case an anesthetic is needed later. If the child is thirsty, moisten the lips with water. If the child becomes unconscious, position him on his side and check the ABC, airway, breathing, and circulation. If an ambulance has not already been called, get someone to call for one immediately.
Remember, children from 9 months to 3 years learn by putting everything in their mouths. They are mobile and by 18 months can usually climb and easily open cupboard doors, medicine bottles and cleaning containers. Children at this age also imitate. They watch adults taking medication and they want to copy. She cannot read the warning label, and to her, this medicine looks like lollies.
If you think your child has swallowed something harmful, take the container and any residue to the telephone. This is done for 3 reasons. To estimate the dosage taken. For instance, if you know there were 20 pills in a bottle and there are 10 left, you could guess that the child has eaten about 10. To identify the poison, and to prevent the child from eating more poison while you're on the phone. Call the Poisons Information Centre or your doctor. Do not make the child vomit unless instructed by a doctor or the Poisons Information Centre. In some cases, you may be told to make a child vomit. If so, have on hand a bottle of syrup of ipecac. It is available from pharmacists and when given, causes vomiting. Don't use it unless instructed by the Poisons Information Centre or a doctor. Always keep syrup of ipecac locked in your medicine cupboard, well out of the reach of children. Never use salt and water or mustard to cause vomiting. The only time you do not immediately ring the Poisons Information Centre is if a poison has got into the eye or if a caustic has been swallowed. Drain cleaners, automatic dishwashing powder and oven cleaners are examples of household caustics. If a caustic is swallowed, immediately give water or milk and call an ambulance to take the child directly to hospital. In fact, when in doubt about the nature of a poison, a small amount of water can always be given. Remember, however, not to give so much water that the child may vomit. While waiting for the ambulance, you may wish to call the Poisons Information Centre for further advice. In the case of poison in the eye, immediately wash the eye with water for 5 minutes. Then ring the Poisons Information Centre or doctor. Take a sample of the poisons with you and a Tupperware container to save vomit samples to show the doctor. You should also be aware that all packet warnings are not the same, but the warning that all parents must obey is keep out of reach of children. Now, this bottle is clearly marked weed killer, but a child could mistake its contents for soft drink. Therefore, never store anything in soft drink bottles. The point is that poisoning is not due to fate. It can be prevented. One design solution is a child-resistant cupboard for toxic materials. Never leave medicines lying around the house. If you have young children in your home, be sure to ask your chemist to dispense your prescriptions in child-resistant packaging. Be careful too when friends or relatives are visiting. They may have medication in their handbags, so for safety's sake, store visiting guests' handbags well out of the reach of inquisitive little fingers. Eating poison is dangerous, but sometimes, unless care is taken, even eating food can be dangerous.
Babies can easily choke on large pieces of food.
Mum, this never happened to Superman.
You need to fly a little higher. There you go. Ah, dear.
Thanks, Mum.
There you go, take it with you. Chicken and hard foods like uncooked carrots have been caught in young children's airways.
If the child can speak, cry and stand, but is coughing and wheezing, an air tube may be partially blocked. Don't slap the child's back or try other measures. The object may move and cause complete blockage. Call your doctor or nearest hospital. However, if the child can't breathe, can't cry or turns blue, the breathing may be completely blocked. Try to have someone call for an ambulance. Hold smaller babies lying face down on your lap or arm with their head downwards. Try to dislodge the obstruction by using the heel of your hand to thump 4 times between the shoulder blades. But beware, you are an adult and your strength could injure the child's bones. For larger children, place them over your lap, supporting the head. Using the heel of your hand, thump the child sharply between the shoulder blades. If after several tries this doesn't work, firmly grasp the sides of the chest over the ribs and give 2 short, sharp pushes with your hands. For babies, use 3 fingers rather than the whole hand and reduce the amount of pressure. In small babies, it is almost impossible to get your fingers in their mouths. However, in older children, keep turning the child over and look for the obstruction in the throat. If you can adequately get your fingers around it, then pull it out. But beware, if you can't get a good grip on it, you may end up pushing the obstruction further down the throat. If all of these maneuvers fail and the child falls unconscious, try mouth-to-mouth resuscitation for children and mouth-to-nose and mouth for infants. This may clear the blockage by blowing air past the obstruction. After the child commences breathing, call an ambulance.
Not concentrating on eating or playing and eating at the same time is a hazard. A particle of apple can become lodged in the throat and block the airway. Teach children to sit quietly when they are eating. These hazards can be controlled with awareness. All littlies put things on their heads. Plastic bags left lying around are also a suffocation hazard. The plastic quickly molds around the nose and mouth and suffocates. Let's look at ways of controlling these hazards. Many children are injured when something interferes with their ability to breathe. They can choke on pieces of food such as boiled lollies, peanuts, or even small pieces of toys. Check young children's toys do not have small detachable parts or are filled with small beads that can come out if the toy's seams are broken. Beware of older children's small toys and adults' appliances that use disc batteries. Disc batteries, if swallowed or choked on, can leak battery acid. If you suspect your child has swallowed a disc battery, call the Poisons Information Centre immediately. Watch too for things that can pull tight around your child's neck and stop them from breathing. I never put my babies to sleep without first removing their bibs. I also avoid dummies with ribbons and baby necklaces because they are dangerous. They can easily pull tight around a baby's throat and stop their breathing. Even curtain cords and toys with overly long strings can be a hazard. That's why choking and suffocation is the 3rd largest cause of accidental death for children. But this can be controlled.
Another hazard can occur when a child is left unattended in a car. Never be tempted to leave a child in a parked car for a moment. Even on cool days, sun beating down on the glass windows will raise the temperature inside the car dangerously within a very short time. Very soon, the child is suffering from heat exhaustion. Quickly take the child to a cool place. Remove or loosen the child's clothes and sponge rapidly with cool water. Use a fan to cool the child and administer liquids. Seek medical advice. During the long, hot Australian summer, extra precautions need to be taken to protect the sensitive skin of children from the harmful effects of too much sun. You may initially be able to get them to slip on a shirt, slap on a hat and slop on some sun cream. But before long, the clothing is discarded and the creams have washed off in the water.
Hey, surfies, why don't you come in the shade for a while? Have a cool drink.
In a minute, Mum.
In a short time, intense heat can badly burn children and cause acute exhaustion. If your child is suffering from suspected heat exhaustion, take them out of the sun and give fluids. Loosen or remove any unnecessary clothing, cool their bodies with a sponge, and use a fan. In summer, the additional hazard of drowning is of major concern, not only along the coastline, rivers and lakes, but also in the home. Toddlers love water, and drowning is most common among children 1 to 3 years of age. This trough was empty yesterday, but filled overnight with rain. A toddler can easily drown in just a few centimetres of water. Because their heads are large in relation to their bodies, they can easily topple into swimming pools, bathtubs and nappy buckets. It's difficult for them to raise their heads and breathe freely again. Drowning is a major cause of accidental death and therefore requires an awareness of drowning hazards, especially if you have a pool. A swimming pool without a child-resistant safety fence is a definite hazard, but so is this. A child could easily climb over the fence here. And what use is a fence if the gate is left unlocked?
Sarah! Quick, call an ambulance!
In the event of drowning, send someone immediately to call an ambulance. If the child is unconscious, place her on her side and clear the airway. If the child has stopped breathing, give mouth-to-mouth resuscitation. If the child's heart has stopped beating, give heart massage. Do not stop CPR resuscitation to call for an ambulance. Get someone else to do it for you. Let's explain these procedures in more detail. You may have heard the terms mouth-to-mouth resuscitation, heart massage, and cardiac pulmonary resuscitation, known as CPR. The only way to learn how to perform these is to practice them in an official course. Representatives from the McKinnon School of Nursing at the Children's Hospital will now demonstrate resuscitation. But remember that this demonstration is merely an awareness session. Competence can only be obtained from a recognised training course. First, mouth-to-mouth resuscitation. If the airway has been cleared, look, listen, and feel for breathing. If there is no breathing, place the victim on his back. Tilt the head back with one hand and support the jaw with the other. This lifts the tongue away from the back of the throat. Seal your mouth over the victim's mouth and close the nostrils with your cheeks. Watch the chest rise as you blow in. Take the mouth away and let the air come out of the child's mouth. Repeat the procedure 15 times a minute until the child starts to breathe unaided. Place the child on his side and maintain a clear airway. The procedure is slightly different for a small child or infant. Cover the mouth and nose with your mouth, and with a baby, do not tilt the head back. Simply puff air from your cheeks 20 times a minute. When mouth-to-mouth resuscitation is combined with heart compression, this is called CPR, cardiopulmonary resuscitation. Apply CPR when there is no breathing and no pulse. With the victim on his back, find the middle of the breastbone. Press over the midpoint using the heel of one hand. Compress with moderate pressure about 80 times a minute. For a baby, use light pressure with 2 fingers only. Press quicker at about 100 times a minute. Never practice heart compression on a person. It can have dangerous effects on a beating heart. After compressing 15 times, give 2 breaths of mouth-to-mouth resuscitation, or mouth-to-nose and mouth for an infant. Recheck the pulse every 2 minutes. If the pulse returns, Stop the compressions, but continue mouth-to-mouth resuscitation until breathing starts again. Then turn the victim on his side and call an ambulance. Never leave an unconscious child alone. Check the ABC every 2 minutes. Remember, airway, breathing, and circulation. By learning these simple procedures, you can be ready at any time to save your child's life in an emergency. CPR courses are available from Red Cross, the National Heart Foundation, McKinnon School of Nursing, Royal Life Saving Society, St John's Ambulance, and the Surf Life Saving Society. The Red Cross Family First Aid Kit has the following components: dressing strips, adhesive tape, non-stick dressing, sterile dressing packs, slings, tissues, tubular gauze, antiseptic liquid, eye bath, gauze swabs, scissors, splinter forceps and probe, assorted bandages, and the ever-handy notebook and pencil, safety pins. We also recommend syrup of ipecac and a fire extinguisher. That's the equipment. But how much have you remembered about first aid procedures? In an emergency, move swiftly and calmly. Check for unconsciousness. Lay an unconscious child in the lateral position and check the ABC: airway, breathing, and circulation. No breath means start mouth-to-mouth resuscitation. No pulse means start heart massage. Check a wound to see if anything is embedded in it. If there is nothing, press firmly on the wound with a clean pad or your fingers and elevate the injured limb. Do not attempt to remove anything embedded in the wound. Slow the bleeding by pressing firmly on both sides of the embedded object and elevating the injured limb. Now, burns and scalds. Remove unstuck clothing and jewellery and submerge the burn in cool water for about 10 minutes. Cover with a clean, non-fluffy cloth and get the child to hospital. Shock is common to all emergency situations and continues after the accident. Reassure the child who appears pale and unwell. Lay them on their back and raise their legs. Loosen tight clothing and keep them warm. Do not overheat or give liquids. If they lose consciousness, check the ABC.
For treating poisoning, call the Poisons Information Centre. The exception is if the child has swallowed an acid or corrosive substance like Drano, oven cleaner or automatic dishwashing powder, or if there is poison in the eye. If the child has swallowed caustic, give water or milk immediately, then call an ambulance. If there is poison in the eye, flush with water for 5 minutes, then call the Poisons Information Centre. In some cases, you may be asked to make the child vomit. Only induce vomiting if told to do so by the Poisons Information Centre or your doctor. Use syrup of ipecac. Never use salt and water or mustard. A child with blocked airway can speak, cry and stand, but does cough and wheeze. Do not slap them on the back. Go to the doctor or hospital.
A child who can't breathe or cry and turns blue may have a completely blocked airway. Send someone for an ambulance. Hold smaller babies lying face down along your lap and head downward. Place the fingers of your other hand at the back of the child's head. This controls the force of the hand. And thump gently 4 times between the shoulder blades. Place older children across your lap. Support the head and thump between the shoulder blades. If this fails, firmly grasp the sides of the chest and give 2 short, sharp pushes with your hand. Again, be careful. Remember the baby's size.
In older children, where you can keep checking for the obstruction, remove it if possible. If the child becomes unconscious, commence mouth-to-mouth resuscitation. To treat heat exhaustion, you need a cool place. Remove or loosen clothing and sponge rapidly. Use a fan administer liquids and seek medical advice.
In the event of a drowning, send someone for an ambulance. If there is no breath, commence mouth-to-mouth resuscitation. If there is no heartbeat, continue mouth-to-mouth resuscitation and commence heart massage. This combination is called CPR.
That's really good, terrific. Children are our most precious asset. It's simply not good enough that the potential of so many children is impaired or lost every year.
But the good news is that accidental injury can be controlled, but we must identify the hazards. Identify the physical hazards that contribute to accidents, like heat, poison, electricity, and cutting edges.
Identify design hazards that make products and houses a danger to use. This veranda has no barrier to protect falls. Identify behavioural hazards like a child's curiosity, and identify systems hazards. We need an organised approach to safety. For example, when there are no rules about picking up toys, there is a greater risk of injury. Once you've identified the hazards, they need to be controlled. One way is to remove the hazards. For example, flush unwanted medicines down the toilet. Consider changing toxic products for non-toxic alternatives. For instance, using dried lavender and cloves rather than mothballs. And empty the bath or trough when you're finished. Simple, isn't it? If you can't remove a hazard, then safeguard it by placing a barrier around it. And fire screens should be secured to the wall.
If you must come in contact with something that can cause injury, then use protective clothing like oven mittens and protective sports equipment.
If hazards are to be controlled, people need to be educated to avoid injury. For example, children need to be instructed to sit while they're eating to avoid choking.
No way I'm going to choke, Mum.
You will if you talk while you're eating. Even grandmothers need to be made aware not to leave their handbags lying around. They often contain lollies and medicines. So we ask you to take the time to control hazards. Only then can we safeguard the future of our children.
Understand first aid and be prepared for every emergency situation.
Yeah, everything happened to me in this video, didn't it, Dad?
It sure did, Danny.
But I was only acting. There's no way Captain Zap can really get hurt.
I'm not so sure about that.
No, neither am I.